My name is Dr. Helen Lavretsky. I'm a professor of psychiatry here at UCLA. I'm the director of the Integrative Psychiatry Clinic and the lead of the research pillar of the Integrative Medicine Collaborative. Today, I will be presenting on disaster stress, considering COVID pandemic, mental health and aging, and how mind-body therapies can build resilience to offset the damaging effects of stress. I have to disclose authorship and royalties for the books that contributed to some content in this talk, Resilience in Aging Research and Practice, and Complementary and Integrative Therapies for Mental Health and Aging. I'll talk about growing global distress, global aging, and mental health, stress during COVID-19 pandemic, review neurobiology of stress response, and then review the evidence of mind-body yoga therapies for resilience and psychological well-being, and present some of the results of the study that we've done in dementia caregivers on the effects of yogic meditation to reduce stress and improve mental and physical functioning. So this slide was developed before the pandemic. And even at that time, in 2019, it was obvious state of the global mental unhealth, where 450 million people suffer from a mental or behavioral disorder. Nearly 1 million people committed suicide every year. And 4 of 6 leading causes of years lived with disabilities are due to neuropsychiatric disorders like depression, alcohol use disorder, schizophrenia, and bipolar disorder. And 25% of the families, 1 in 4 families, has at least one member with mental disorder. And that amounts to trillions of dollars in cost that will triple, and with pandemic probably increase even more by 2030. So with that, what we're dealing with is population aging, where the number of people 65 years of age and older is increasing, and children under 5 is dropping dramatically. And the population just crossed just before 2020 with a significant increase in elderly in our society that will progress, increasing because of the baby boomers boom or aging process. And here is the poll of anxiety and stress symptoms due to COVID since September 2020, or by September of 2020. That's when the American Psychiatric Association conducted this poll, where 62% complained of being anxious, feeling more anxious compared to 2019. And the main complaints or concerns were keeping families safe, racism, COVID-19, getting one or dying from one, gun violence, and presidential election. Just to review the symptoms of stress, it's a fear, worry about own health and the health of loved ones, financial situation or job, or loss of support services. Changes in sleep or eating patterns, difficulty sleeping or concentrating, worsening of chronic health problems, worsening of mental health conditions, increased use of tobacco or alcohol and other substances, irritability, anger, and violence. So this slide presents the model of stress and health, where it sort of explains why we differ in how we perceive and react to stress. And it's determined by our own experience since childhood, due to different experiences to trauma, abuse, environmental stresses like neighborhood, work-home situation, and also our genetic predisposition, developmental experiences, and choice of personal behaviors, the type of diet, smoking, drinking, use of drugs, or exercise would modify our stress response. And our body is evolutionarily built for dealing with stress and surviving because of it. It's called allostasis, keeping body stable during stress, that leads to adaptation. But when stress becomes too long or too strong, we develop maladaptive reaction like allostatic load. So allostasis, as I said, means maintaining stability through change, but the price of adaptation to stress and aging is the development of hypertension, systolic and diastolic blood pressure go up, waist-hip ratio, cholesterol, blood sugar, also hormones of stress like cortisol, norepinephrine, epinephrine, and protective substances like DHEAS go down. And the disaster response has been well documented in prior studies of climate change related to climate disasters. And typically a person or a population of the area affected would go through this stages of immediate, when it's immediate infection. We went through this in March, leads to kind of mobilization when people get together and they march through that challenge. And then the second phase is facing psychological trauma, mental health, burnout, worsening with new outbreaks as we experienced in 2020, and then development of anxiety and depression. Phase 3 would lead to impact of resource restriction or urgent non-COVID conditions like we're facing right now. And then phase 4 we're about to enter is dealing with the impact of interrupted care on chronic conditions. So just to describe what would work in each phase or how it went. So the heroic phase in March was presented with altruism, rescue, operations, open access innovation like development of meditation apps, yoga online, free group meditations. That's when you saw communities coming together, singing from the balconies or dancing in the street by the doors. So the community and neighborhoods come together to fight it. Then the honeymoon period in April, May was characterized by highly motivated, optimistic, energized heroism. But everybody understood that we needed to pace ourselves for a long overhaul. And that's when Zoom and virtual platforms got overwhelmed, developed different applications and options for stress reduction and social connectedness. And then late May through summer, disillusionment, low energy, exhaustion, anxiety, depression, anger, compounded by Black Lives Matter protests and financial crisis. And that's where we had to start looking for silver linings, blessings in disguise, expressing gratitude for what we have, taking care of our bodies, paying attention to our bodies, resting, sleeping, initiating creative projects, exercising more, using our spirituality, laughter, and surrendering control, because really here nobody can know what is to come and can control anything within except our own reaction. And trust that this has purpose. This experience is teaching us something. So in the reconstruction phase, we would have to build new options to return to recovery and responsibility. Nobody really knows how, when, and for how long. Hopefully with the vaccine development, we'll be able to control it a little bit better and know where we're going or see the light in the end of the tunnel. During all of this time, there's been amazing frontier innovation. Entrepreneurs and scientists coming together, developing artificial intelligence, different applications for iPhones, assistive technology that will reshape workforce, leading to simpler living, vocational retraining because of multiple industries have suffered so dramatically. Something will be done to reshape industries and how things are done in the society, including schools, restaurant business, hospitality business, and many others. Heightened awareness of the process and potential is now within the public because, you know, we have to deal with this. We have to reinvent ourselves and our society. And government may or may not help you. So, you know, government so far has not been very encouraging in terms of being able to handle it. Resilience building, prepare humanity to be more flexible, proactively deal with disasters, honor self-reliance and strengths, take care of each other. And cooperative global solutions lead to unity consciousness. So despite the fact that the country is now politically divided, that's what it would take to conquer COVID pandemic and climate change. Cooperative global solutions and unity consciousness, where we're considering everybody else's best interests. World Health Organization defines mental health as a state of complete physical, mental, and social well-being, and not the absence of disease or infirmity. It's a state of well-being, perceived self-efficacy, autonomy, competence, intergenerational dependence, and recognition of the ability to realize one's intellectual and emotional potential. Individuals are able to cope with stresses of life, work productively and fruitfully, and make contribution to their communities. The dimensions of wellness are all-rounded and include mental, emotional, physical, social, environmental, and spiritual wellness. And so all of these facets have to be addressed to achieve all-around wellness within oneself. So here is a quote from Gurmukh Khalsa, who's a yoga teacher: "Happiness is a choice and a birthright." And because we have this birthright of being happy, we can choose it. But the process of achieving and maintaining happiness might require individual effort. Happiness is a consequence of personal effort. You fight for it, strive for it, insist upon it, and sometimes even travel around the world looking for it. You have to participate relentlessly in the manifestation of your own blessings. And once you have achieved a state of happiness, you must never become lax about maintaining it. You must make a mighty effort to keep swimming upward into that happiness forever and stay afloat on the top of it. So here in that quote, which is, by the way, is wonderful, by Elizabeth Gilbert from Eat, Pray, Love, that is a book and a movie. And here are the several quotes from Confucius, Amanda Ripley, and Winston Churchill characterizing resilience. Resilience is that ability to maintain happiness. Resilience is a precious skill. People who have it tend to also have three underlying advantages: a belief that they can influence life events, a tendency to find meaningful purpose in life's turmoil, and a conviction that they can learn from the positive and negative experiences. So resilience is this dynamic characteristic that buffers one from trauma, adversity, stress, and allows one to recoil, recover, and maybe even adjust at a better level of functioning than before a trauma occurred. Does it require major traumatic experiences? Probably not. In this time, surviving day to day could be challenging enough to test our resilience. This construct can be fostered in younger and older individuals and children, and things to do about it can boost effective and positive coping, turning adversity into the opportunity for growth. We have been busy developing interventions that enhance resilience using integrative medicine approaches, and all of it could lead to better outcomes for medical and mental disorders of aging. The biomarkers of resilience are now have been outlined in the brain, demonstrating neural substrates, including prefrontal cortex, hippocampus, amygdala, anterior cingulate as a pathway for resilience, but also stress hormones of the hypothalamus, pituitary axis, adrenal axis, and inflammatory mediators, because chronic stress leads to this chronic inflammation that is a common denominator for all diseases of aging, like heart disease, cancer, Alzheimer's disease, depression, and many others. Also, brain becomes more vulnerable as we age because of this cumulative exposure to stress and other pathogens throughout our lives. And the longer we live, the more we accumulate. So by in our 50s, brain takes some hit from developing cardio and cerebrovascular disease, heart disease, neurodegenerative changes, and chronic inflammation that may tip one into depression. So you experience stress, but if stress is too prolonged and you don't have too much resolve or resilience, you might develop depression or anxiety. The resolve and resilience here may come from social support and engagement, social engagement, participation, physical and cognitive engagement, and brain reserve. And here, some resilience building interventions are outlined, including well-being therapy, learned optimism training, hardiness training, that focus on positive aspects of difficult experiences, promoting more positive perception of challenges. By modifying lifestyle factors like diet, exercise, spirituality, we might experience rebalancing of our ability to cope with stress and enhancing resilience by creating physical and mental well-being. So complementary and integrative medicine lends itself as a holistic approach to wellness that encompasses varied approaches to wellness and stress reduction, including yoga, breathing exercises, and many others. They tend to cultivate joy and change attitudes toward death and dying as a natural part of life, to combat fear of death, because it's so pervasive right now in our society. We're all terrified of getting COVID and dying from it. So to list some of the mind-body medicines, yoga, guided imagery, meditation, hypnotherapy, spirituality, Tai Chi, Qigong, expressive art therapies like art, dance, music, and then virtual reality I'm very interested in, and I think it will become a greater platform for well-being. For instance, yoga on Zoom now moved with COVID. We're offering now yoga classes through the Integrative Medicine Collaborative. And yoga exercises for fear of death and dying. I really wish somebody would develop this as a tool for everybody. Priorities for mind-body research to enhance self-regulation, ability to withstand stress, and center oneself and make cool-minded decisions instead of knee-jerk reactions. That leads to a more healthy response, and then you don't regret your decisions. It enhances physical and mental health. It helps manage pain, depressive and anxiety symptoms, insomnia, PTSD, post-traumatic stress disorder, impact health and prevention of disease. This mind-body therapies and overall integrative therapies are intending to modulating stress response, and that's when brain, autonomic nervous system, hormonal, and immune systems talk to each other. They modulate each other, change expression of each other. And so something like biofeedback or meditation can enhance brain regulation of autonomic hormonal immune pathways. Acupuncture can work peripherally as well and centrally. Fortunately, according to the recent National Health interview, yoga was commonly used, and the interest in yoga has increased even before pandemic, jumped to 14%. We have seen an increased public interest in stress reduction, stress management with breathing exercises and yoga. So I suspect that public will be open to this even more so as a result of pandemic. Generally, women and non-Hispanic whites tend to practice yoga, meditation, and chiropractics compared to men and minorities. And the yoga uses the greatest in the age cohort of between 18 and 44, and meditation is more prominent among middle-aged and older adults. Mindful practices could be very, very helpful in promoting stress reduction, treatment and prevention of depression in high-risk populations, like stressed caregivers, older adults with chronic medical illnesses, victims of psychological and physical violence, direct neuroplastic effects in the brain across lifespan that we have documented, and others as well. And it leads to shifts in conscious awareness of reality, cultivation of well-being and gratitude, instead of feeling like a victim of the circumstances. That allows for better control of your immediate environment. As far as aging, these practices, mind, body, dietary, physical activity, body-based, and natural products have been documented to influence mechanisms of aging by compressing morbidity, improving side effect profile, benefiting cardiometabolic, bone, and vascular health. And the biomarkers of aging are genetics, epigenetics, telomere attrition, telomere lengths, inflammation, cellular senescence, mitochondrial function. And that all of that has been documented to improve with this integrative therapies. I don't have to explain what yoga is, but it's not just a yoga boot camp, but it's actually a system of ancient philosophy, practices, and lifestyle that uses different aspects like breath control, specific bodily postures, asanas and mudras, and meditation. It's used worldwide for health and stress reduction. Mindful exercise, moving meditation like yoga, qigong, and tai chi are increasingly utilized for improving psychological well-being, hypertension, cardiovascular disease, insulin resistance, depression, anxiety, and most recently cognitive decline in older adults. It is a physical exercise that is executed with profound inward focus of contemplation or awareness. It is non-competitive, and centered breathing is a part of it, conscious breath, and focus on anatomic alignment, spine, trunk, and pelvis, and also energy. That is something that we don't measure in mainstream medicine, but is a known entity. Life force, sekam, prana, chi, and kundalini are the synonyms characterizing this phenomenon. Prevalence of yoga, millions of people are now practicing it, and as you can see from this table, not much difference between ages, except in 65 and older, meditation is more popular. The reason to practice it is for general wellness, improvement of energy, immune function, athletic or sports performance, flexibility, or memory and concentration. And the reported effects are reduced stress level, improved overall health, feeling emotional well-being, better sleep, then coping with health problems and other problems, and relationships and job performance are improved. What are the key elements of yoga? As I mentioned, musculoskeletal strength and flexibility, breath control, concentration, attention, mindfulness, awareness, imagery, visualization of light, for instance, that what we use in our studies, physical sensation, body awareness, psychosocial interactions, spirituality, beliefs, norms, rituals, iconic teachers and gurus are shared by the communities who are followers of a particular teacher, and shared environmental influences like, for instance, preference for vegetarian diet or some supplements. We published a paper describing and discussing the difference between mindfulness-based brain changes versus mindfulness. And here, the areas that are affected in green, in purple, prefrontal cortex, in green, posterior and anterior cingulate, and striatum in light green, insulin yellow, and amygdala. And the centers are influencing cognitive processing, executive control, mood regulation, memory, sensory awareness, reward and motivation, and emotional processing of fear and anxiety. Amygdala is a particularly important structure. So we found by reviewing multiple studies that mindfulness activated 4 regions: premotor area, mid-cingulate, angular gyrus, and primary and secondary somatosensory cortex, that are areas of motor and emotional and somatosensory integration, leading to a greater awareness of self or consciousness. And that could be used for mood disorders, anxiety, impulsivity, movement disorders, stress, and so forth. Yoga, because it includes many more elements, like I described, a lot more physical participation, visualization, could be very different practices, really, depending on what you use in a particular yoga practice or a particular meditation practice. that would activate different parts of the brain. And here we saw differences in dorsolateral prefrontal cortex, medial frontal cortex, superior temporal area, paracentral lobe, precentral and postcentral gyrus, superior parietal lobe, and so forth, that are areas of judgment, discernment, memory, language, visual, spatial, and some other sensory integration. And if you do yoga, these areas are benefiting from the yoga exercises. So if you can't do yoga, go to a yoga class, you could breathe. Everybody breathes, so it's non-controversial. And I usually prescribe breath practices to my anxious patients or those who are stressed to regulate their blood pressure and heart rate. All it takes is really to slow your breath. And you have to get to a breath rate from 10 to 12, which is normal, 10 to 16 breath movements per minute, inhale, exhale, to 4 to 6, in order to achieve this effect of reduced blood pressure, heart rate, and anxiety and stress. We're actually, so you put in front of you a clock with the second hand, and you count a 3-second inhale, 3-second hold, 3-second exhale, 3-second hold. You could start with 2 seconds and then progress to 4 seconds. We are actually studying 4-4-6-2 breaths with longer exhale that stimulates parasympathetic nervous system to offset stress response and deactivates amygdala, which is a fear organ that reacts to fearful stimuli. There's been quite a bit of research on alternating nostril breathing. And if you close your left nostril and breathe through right nostril only for 3 minutes, it will be activating, stimulating. And left nostril, calming. So if you can't sleep, you just turn on the right side and your left nostril is breathing, and that's what produces this calming effect. The right to left is a 3-minute rebalancing breath. You inhale through left, you close right, you exhale through right, and inhale through right, and exhale through left. And then repeat the cycle. You could play music, quiet music at the background, and that leads to relaxation, but your attention is on your breath, so quality of breath or how you breathe. O breath through mouth, like a straw, you're sipping through a straw. Exhale on the count of 4. It fills up and empties out your lungs that have 2 gallons of oxygen or air capacity. It's a very cooling and detoxifying breath. So if you're very stressed, you feel hot, or you need to exercise your lungs, that's a very nice and simple breath to follow. So we studied Kirtan Kriya. It's an 11-minute chanting exercise in the Kundalini Yoga tradition. It has a mantra recitation that is done out loud, whisper, silent, whisper, and out loud for 2 minutes, 2 minutes, 3 minutes, 2 minutes, and 2 minutes, respectively. It means birth, life, death, rebirth, Satanama. It has a tune, Satanama, and you do the mudra, Satanama. You close your eyes, you focus on this eyebrow point, middle point, and you imagine white light coming through the top of your head, going through the middle of your brain, and coming at the brow point. So that's what we show on this L-shaped form light that you're visualizing. So it's a multitasking meditation. You're chanting, you're tapping your fingers, you're focusing on the eyebrow point, and you're imagining light, white light or golden light coming, circulating through your brain, basically. And the physical benefits of the mantra: Sa is expansive, Ta, strength, Na, universal presence, and Ma, quality of communication. So in yogic tradition, kriyas are used to help bring body, mind, and emotions into balance and creating healing. Anything that uses left and right would rebalance your brain and nervous system, because it goes to hemisphere, opposite hemisphere on the other side. And it rebalances if you go alternating nostril breathing or you tap both hands, it would stimulate both sides of the brain. So we studied dementia caregivers who were stressed and a little bit depressed, moderately depressed. For 5 years, they were taking care of relatives with dementia. And it's a very, very stressful job. They can't really come for yoga classes, and but they could take 11 minutes out of their day to practice this kriya. What we saw in them was that depression dropped in the meditation and relaxation group, but in the meditation more profoundly. Relaxation group was asked to go to a quiet place, close their eyes, and listen to the music. Okay. So resilience also increased with this practice, in meditation more so than in relaxation, but relaxation was also a powerful tool. If you just close your eyes for 12 minutes a day, listen to the music, you will feel better. But then when it came to cognition on multiple measures, but here it's a global cognition mini mental state examination score, or even more so to telomerase activity, which is a biomarker of aging, cellular aging, or gene expression, that's when groups really diverged, and the meditation group had better profile in telomerase. Relaxation didn't change, how it went down. And here is 64 genes show difference in expression. And what happened in the meditation group, NF-kappa B pathway was reduced, suppressed, which means reduced inflammation. But IRF, or interferon response factor, increased, and that is a protection against the viruses. And that's very relevant for COVID and the flu season that we're in. Also in the brain, we found group differences in inferior frontal lobe and in posterior visual cortex, because we used visualization and we used this multitasking. That's the area of the brain that are responsible for this function. And also compared to non-meditators, meditators activated self-referential areas of the brain, anterior cingulate orbital insular network, that are responsible for self-awareness, how our body works, mind-body attunement. We got very, very famous because of this study, and it was supported by the Alzheimer's Research Prevention Foundation, and many of my collaborators have contributed to that, including my postdoctoral students who published a lot of papers on this subject. And I would like to also advertise this upcoming Convergence Mental Health Transdisciplinary Approach to Innovation book that is published now and will be launched on January 5th on Amazon. That presents an interesting constellation of chapters from innovators, scientists, and entrepreneurs that looks at post-COVID technical innovation that will be very informative to general public, but also scientists and clinicians. Thank you very much for your for listening to this. Thank you.